This is good because I can see your expression on the camera too. This is really good. This is your first time ever getting your neck adjusted, right?
I think so, yeah.
So what I need from you is I'm going to get you to turn your head as far as you can to the right. There we are. We're getting relaxation of that SCM muscle. I'm going to contact here, pull over.
Oh my god.
There you are. See, that was only slightly terrifying, right? Yeah. I feel like I am getting more tension on the right side occiput, the very top. Same deal. Turn as far as you can to the left, please, and then drop the head. Nice. So she just shut that off immediately now that she knows what's coming. Very good job. Let's take a big breath in, and all the way out, all the way out. Good, 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 good. Good. Breath in, all the way out. Go. Right, so she's in the right position. Gonna get you to take another breath in, all the way out, all the way out. Good.
Oh.
That's a big one, eh?
Nice.
Thank you. So we're gonna bring this up, scooch you close to me, and then all the way out, all the way out. Good. She's very relaxed for somebody who hasn't seen a chiro in forever. Well done. Well done. Steph, good to meet you today.
Hello, nice to meet you.
Steph was recommended, in by a friend of hers who had a positive experience here. But I'm going to let her kind of talk about what she's in today, hoping to achieve. So, Steph, why don't you tell us about what's going on?
Mainly want to focus on shoulder and back. I work on my feet a lot, so I have a lot of lower back pain, and then I was doing yoga yesterday, did the fold over position, and noticed some tension in my upper back as well. So I kind of want to focus on that.
Of course, of course. Now, okay, let's break that down a bit. So you said you mostly work on your feet. What do you do?
I work as a bartender and an usher at Myofascial, so I'm constantly on my feet. If I'm in the house, I'm standing for 4 hours straight watching the show.
Well, that's actually good that she's moving around a lot, because usually we see a lot of the other problem with people sitting too much. So here we've got a bit of a rarity, right? She's got the opposite problem. Now, I was a bartender too before I became a chiropractor, and let me tell you, you're working long hours, you're hustling because you want a good tip, so I understand the work you're putting in, and doesn't help that the floor is probably super slippery too. So do you ever pull any of those up, like stabilization?
No, actually, we're pretty good
with having, shoes.
We have mats down.
Okay,
too,
you meet safety code. That's why you got a boss that cares about you.
We
Okay, that's why. Okay, so then you were doing the fold over pose. Would you mind actually standing up and demonstrating that if you can, because there is some ambiguity in some of these poses.
So I was doing this one.
So we're doing full flexion of the lumbar spine.
Yeah, and then all up here I could just feel it stretching and it
curved. All right.
Yeah.
So I'm not sure if you saw it on camera there, but Steph was pointing to what we know to be the CT junction, or the cervicothoracic junction, where the neck becomes the upper back. You guys would know anytime we hit one of those transitional zones, we experience more shearing forces due to opposite directional movements. We get more stiffness. So I'll translate that all down to her in between takes here. But that's a very common site of tension. Okay, it's anecdotally nicknamed the safe because it's always locked up. Now, you also mentioned that you were getting some kind of like just today neck discomfort. Sorry, were you doing the yoga yesterday? When were we doing the yoga?
Yeah, yesterday.
Okay, and now today you got neck discomforts as well.
Yeah, it kind of just feels like I slept on it wrong. It's mainly up here.
Up like right at the top.
Yeah.
Okay, so you've got base of the neck, that CT junction, upper back region, and base of the skull, the occipital region, and lower back complaints. Okay, so that's basically full spine, the works. I hope you're in the right location. I think you're in the right location. Have you done anything to try to self-manage this so far, or?
Just today was did some neck rolls to kind of loosen it up a bit, but I noticed driving my blind spot. I was doing the old person turn to try. Yeah. Hey,
I know. I have plenty of older patients who have that full range of motion, so it's very much that stiff person's turn, right? And it's actually funny that you're, well, not funny that you're dealing with that, but most of the rotation that we get in our head does stem from that occipital region at the very top. So if that is where you're experiencing tension and you're having trouble rotating, that's kind of like a double reason to check that at the top. Have you seen a chiropractor before? I think you said you had.
Yeah, a long time ago, in elementary school, high school.
So throwback then.
Yeah,
you probably. Do you remember at all what you were there for, what they did for you, or has it been too long?
I don't know if I went for anything specific. Yeah. It was just I had benefits through my parents, and they were like, take advantage.
Free therapy stuff, right? No, okay, fair. All right, so what we're going to do today then is we're going to do a physical exam, okay, full spine, and then we'll figure out the best way to go forward and make you feel better, okay?
Amazing.
Awesome. we start every physical exam off a very similar way with a sense of observation, okay, but then we also get into the range of motion. So let's do that. We're going to bring your chin down to your chest for me as far as you can. Now, does that provoke any of the either CT junction pain down here, any of the stiffness up at the very top? No, that's okay. All right, come back up for me. Now, if you could look towards the ceiling, please. What about the extension? That's okay too?
Yep.
Now, what if I actually tilt that further back? Still okay? Perfect. Okay, forward. I want you to rotate your head as far as you can to the right, please. So we can get to about 60, 70 degrees with this. Now let's go as far as we can to the left. So we can get to about 80, a little bit further on the left side than the right side. So she still has quite a bit of rotation available to her, but I'm guessing you usually have a pretty more mobile neck because you were commenting that you were having trouble checking out blind spots beforehand. I'll get you to bring your right ear down to your right shoulder, please. And you just comfortable with that? Yeah, okay, where?
I just feel it here.
Oh, you feel a pull on the contralateral, the other side? Okay, and let's tilt to the left. Anything on this side? No? You're okay? Alright, so just that left side. I'll get you to give yourself a tight hug. You've probably earned it. Rotate as far as you can to the left, as far as you can. Good. So, wow, we can get pretty far with this one. We can get to about 75 degrees, not as far as you can to the other side. A little less on this side. We can get just past 45, maybe like 50, 55. So a bit of an asymmetry, decreased turning right as compared to turning left. You can relax. Next, I'm going to get you to stand up and just bend down, touch your toes for me. Do that fold over pose once again, please. And does that provoke that upper back pain or lower back discomfort? No? Okay, come back up the other way, please. And I want you to extend backwards now. Extend back. What about that?
No.
No? Okay, good. All right, you can sit back down. Bring both arms up for me. Keep them there, please. Fight me. Good. Good. Arms forward. Curl the wrists backward, please. Good. Turn over. Curl the wrists inward. Fingers curled. Keep them strong. Turn over and squeeze my fingers, please. Good. Relax. Turn over. Relax the arm. Good. Good. Drop the arm. Let me hold it. Drop the arm. Go. Now this is going to be a little harder with the camera right there, but okay, I can kind of. Let's just go behind it. There we go. That's how we do it. And relax that arm. Relax. Good. 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 And drop the arm. When was the last time you had your reflexes done?
I don't even know.
While up.
Yeah.
Normal upper limb neuro. And then just relax them as best you can. It's a little harder in people who have longer limbs, but you know, we make do. Good. That's a bigger one on that side. Okay. Relax the foot as best you can. Good. Good. Best you can, relax. Good. Push this leg up in me as hard as you can. Good. Hard as you can. Toe up as hard as you can. And toe up as hard as you can. Good. Normal lower limb neuro. So we're going to get into the orthopedics exam here for Steph. Now we know that we're dealing with like lower back stiffness, upper back stuff, as well as neck. So let's start with the classic lower limb tests. This person looks like they're walking in the wrong door. Yeah, I have a full window of everybody who's walking by, and she seems very confused. All right. Anyways, let's get into the leg. So we're going to bring this straight up as far as it will go. And you definitely do yoga because you can get up to the full 90. All right. Do you find that this causes any discomfort in the low back at all? Or?
I can feel like it pulling, but it's not.
Okay, now that pulling, is it limited to behind the knee, to the glute, somewhere in this region?
Yeah.
All right. So that's just hamstring tightness. That's quote unquote normal with this test. I'll get you to slowly lower this leg down yourself. Does that provoke any low back discomfort?
No.
No? All right. Let's do the same thing on this side. So just the pulling. Anything in the low back?
No.
Slowly lower. Anything in the low back?
No.
No? Okay. Let's bring this up. I'm going to bend the knee. I'm going to place my hand behind your femur here. I'm going to push right through. Any discomfort with that? Good. I'm going to place the hand behind the femur. Any discomfort with that? Good. For the record, we don't want to really have discomfort on these things. Does make my job as a clinician, as a diagnostician, a little bit more difficult because then we don't really know where these stiffnesses might be coming from. But we can still treat. We can still figure it out. So let's do a hip screen. We're going to bring this all the way up. Any discomfort in maximal hip flexion there? No. Coming up. internal rotation. We can get to just south of 45. Any discomfort? And I'm gonna bring this out. That's okay? All right. Yeah, you've got pretty good mobility. I can tell that you do take care of yourself, so take some pride in that, okay? That okay?
Yep.
A little bit decreased internal rotation on the right hip as compared to the left, but nothing drastic. And that's okay too?
Yeah.
Good stuff. All right. Now, being a chiropractor as well as somebody who diagnoses musculoskeletal conditions, well, not as well as that's what chiropractors do. Point is, you should always be putting your hands on a patient if you're trying to diagnose a physical condition. Not doing so is definitely doing yourself and themselves a disservice. So, anyways, that low back stiffness you mentioned, yeah? Are you feeling it greater on the left or the right side?
I don't really feel it that much today.
Well, that's good. You've
Yeah.
improved. Okay. When you were, if you can recall.
I think the left side.
The left side primarily? Okay.
Yeah.
And if you recall, was it kind of lower down here or was it higher up here?
Lower.
Lower down, okay. So this is, as we'd be very familiar with, I'll move my hands so you guys can see the SI regions, okay. Bottom of the spine is the sacrum. Sacrum connects to the iliums, the hip bones proper. The sacroiliac joint, the SI joint, sacroiliac, are the connecting ones there. So we're looking at the left SI joint there versus there. And to me, the right side actually does feel a little bit more protuberant and stiff. It's possible that we get pain presentation on one side due to hypermobility or overcompensation due to a problem on the right side. That is actually more common, at least I see that more commonly, than same-sided pain and issue. But, okay, lower back. And then going into the upper back. Now, you mentioned you were getting this upper back discomfort. Worse on right or left side, or pretty symmetrical?
Pretty symmetrical.
Pretty symmetrical, okay. Is that up here you're feeling it, or more closer to in here?
Lower.
Lower down?
Yeah.
Right there, or lower?
It was there.
Right there, okay. So that seems like the pretty classic textbook levator scap insertion area. Right underneath that, we got kind of the rib heads T2, T3, very close by, so that's something we'll be treating today, no problem. Oh, we got a freebie there. Wonder if the mic picked it up. I'm just going to place my hand on your front hip there and hand on front of the hip there. Good, relax. Try for an upper back adjustment here. Let's take a big breath in and all the way out, all the way out. Good, 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 good. Good. Breath in, all the way out. There we go. Okay, let's bring the mic over. How are those?
Good.
Good. So right in there. So that actually doesn't feel super locked up to me anymore. It's possible that we've recovered a bit, but I'm still going to try in for that region anyways. We're going to get, so the way that we're going to do this one is, again, you're going to take a big breath in, big breath out. While you're doing that, I am going to rotate your head. Okay, you let me rotate your head. Don't help me out, okay?
Okay.
So, big breath in, all the way out. There was a tiny one there. I don't know if the mic would have picked that up, but it was a quiet little guy. Right, so same deal. I'm going to take the contact in through this left scap region right here, and I'm going to need you to take a big breath in and all the way out. Good. Another really small one there, but I'm gonna take this. We're just gonna pull so your shoulders aren't so crowded. Good, good. And hold. I get it now. You reminded me of someone when you came in. You remind me of my cousin.
Oh.
You look a lot like cousin Nicole. Okay.
Oh, nice.
Cousin Nicole, if you watch these, hello. Yeah, all right. So we're gonna bring this up. Hope the UK is treating you well. We're gonna go ahead and scooch you close to me. Good. Okay. So what I'm gonna get you to do here is I'm gonna get you to take a big breath in for me, and then all the way out, all the way out. Good. She's very relaxed for somebody who hasn't seen a chiro in forever. Well done. Well done. All right, so she's in the right position. Gonna get you to take another breath in, all the way out, all the way out. Good.
Oh.
That's a big one, eh?
Nice.
Thank you. So, again, we're getting most of our discomfort, she mentioned, at the base from the yoga she was having, but also from sleeping strangely at the very top of the suboccipital muscle group. I'll go ahead and I'll throw a picture of the suboccipitals up there for you guys because it's been a while since I've shown them. Basically, suboccipital muscle group of four or six muscles, very small muscles that exist at the very top of our C-spine that connect it into the occiput, which is the actual anatomical word for the base of our skull. So these guys are very often responsible for most of the rotational ability in our head, as well as can be big sources of headaches in themselves. Do you get headaches at all or no?
Sometimes
on occasion. Okay, so also possible that the headaches could be related to, just normal drops in pressure with the weather or stress, but cervicogenic type headaches definitely exist as well. So. That there kind of feels like a knot, eh?
Mm.
Yeah, this is good because I can see your expression on the camera too. This is really good. We as chiropractors don't like to stare down at our patients like that because we don't want to breathe on them, and it's also kind of awkward. So this camera setup, this is prime. I like this. All right, we're going to try for that lower left aspect. Okay. So what I need from you, this is your first time ever getting your neck adjusted, right?
I think so, yeah.
Phenomenal. All right. So what I need from you is I'm going to get you to turn your head as far as you can to the right. And I want you to pretend that this hand is a pillow. Just drop your head into it. Good. Okay, so there we are. We're getting relaxation of that SCM muscle. That's how you can tell somebody has turned their neck off. Okay, and they're giving me their full weight. From there, I'm going to contact here, pull over.
Oh my God.
There you are. See, that was only slightly terrifying, right? Yeah. How is that? Happy to hear. Okay. So we got quite a bit down there, and that was kind of the location of most of the complaint. I feel like I am getting more tension on the right side occiput, the very top. So what I'm going to do here is I'm going to move the microphone over to the right side, and we're going to get the right side now as best we can with this angle. So same deal, turn as far as you can to the left, please, and then drop the head. Nice. So she just shut that off immediately now that she knows what's coming. She was good at that. That's good. Oh, testimony to my own self. And we'll just relax right there. Good, good. Very good job. You did great.
Thank
Look
you.
at that. Now, it's that part of the video where we get into the sports massage component, and usually when I do that, I always ask a question of the patient on the table because I want you guys and them to kind of connect. So, question, one of my favorites, is asking what you feel most proud of regarding your career, what you find most rewarding, about your career. So, Steph, is there something about your chosen career path that you find to be rewarding?
Yeah, so I'm an actor, and one of the things that always moves me is how theater brings people together. And so whenever I also work as an usher and a bartender at a theater company, and whenever I'm in-house, I always get emotional at the end of the show because people are dancing or cheering, clapping, and standing up to celebrate the show they just watched. And I always think that's such a moving thing that people do, and theater can just bring everyone into one building together for a moment, and it's just really nice.
So, I mean, human connection is kind of the basis of everything, is it not? It's why we've evolved from small little societies into large metropolitan areas. So, being able to see something like that and being a part of creating that said environment, I understand how rewarding that can feel intrinsically, to say that you had a hand in helping to create this optimism, this happiness, this moment that's happening, right? It's kind of why I used to throw a lot of house parties. But yours sounds a little bit more regulated and safe.
Yeah.
Let's just say that. But no, that's good. It's nice to know that you enjoy bringing other people happy moments. That's how you feel rewarded.
I do, and even as a bartender, I like to do something to make... Like, I don't know what's going on in that person's life or what's happening that day, but I like to at least try to be one joyful moment for them in that day. So I always try to do something to make it a little extra special.
That's very considerate of you. Extra special, like a double shot?
Yeah.
Or like, what do we
Overpour a little bit. Don't tell my bosses, but...
That's fine. This is only going online. Let's hope it doesn't go viral. Make this viral, guys. Okay, there we go.
What about yourself? What would you say you find the most rewarding?
You know what? No patient has actually asked me that back when I asked that question. You'd think that I would have a good answer for it. What do I find most rewarding? I think I like the thing about being a chiropractor in Ontario is that we have quite a bit of scope of practice in that we can treat in many various ways. So there is a bit of a stigma about the chiropractic profession. I made a whole video about this. You guys can watch it up on the top right corner there. But there is a bit of a negative stigma attached to my profession, and I don't think we've done ourselves many favors. That being said, I do really like bringing patients in who've seen physiotherapists, chiropractors, osteopaths, whatever the hell, and getting them better with complaints that they haven't been able to resolve before, right? And they've had all these professionals, these doctors, these practitioners look at them and try something and it hasn't worked. And really, it usually just comes down to either those examinations weren't in-depth enough or the treatments weren't comprehensive enough. Very simple stuff that isn't anything different than simply what I was taught at my school. So it is really nice just being thanked by these people, you know, after you've resolved the issue. And usually they do that in like abundance, where they first come in nearly in tears about how much pain they're in, and then they're better, right?
Yeah.
Like, you did that with nothing more than your hands and your knowledge. So that's I find that very rewarding. It's very empowering to know that I can help in this way, in ways that other people either cannot or will not for whatever reason. Yeah, that's probably what I find the most rewarding, just helping others.
Yeah, that's awesome. Yeah, I've seen videos of people who've come in with like constant headaches and they go to a chiropractor and they have instant relief after they've been worked on.
It all depends, right? Like, I mean, for cervicogenic headaches, like I mentioned before, headaches that stem from the cervical structures, hence cervicogenic, yeah, they're going to respond really well to getting adjusted. I had a patient who had migraines for like most of her life and then came in and we managed to get rid of like 95% of them.
Wow.
So, like, even though it's not 100%, she's so thankful. And I'm very thankful to have met her, right? Also made a video with her. You can go watch that. You can go watch that in the top right corner. That's knotted up. Give that a rest. I feel like I've been hitting it hard. Okay.
Did you learn how to use this in school as well?
Nope. You have to take an extra course. We're going to finish off with a little something known as myofascial release technique. Okay. Doesn't always feel great, but
Okay.
we do things here for the after effects, okay, not the current. So we're going to work kind of, again, that base of the neck,
Okay.
up here, the levator scap and the upper traps. So I'm going to pop your collar
Yeah.
like you were cool in the 90s. And I'm going to get you to look up and to the right. Other
That's
right.
the right.
There you go. Yes. 50% of patients get that wrong. So that's it happens.
Part of the 50%.
Woo! I'll get you to now. I'm going to take my people's elbow, put it right there, and get you to slowly look down into the left, okay? Good. And come right back. And then slowly down to the left. Is that tolerable?
Mm-hmm.
Good. Up and to the right. Slowly down to the left. Up and to right. Slowly down to the left. Oof. Up and to right. Slowly down to left. And to right. Slowly down to left. Good. Okay. Face forward. Tilt your right ear to your right shoulder. Now I'm going to take my elbow, put it in there, and slowly tilt your left ear to your left shoulder. Good. Right to right. Left to left. Right to right. Left to left. Right to right. Left to left. And right to right. Left to left. Good. All right. Now up into what you originally thought was right. Good. And now we'll go down into the left. Go ahead. Up into the left. Down to the right. Up into left. Down to right. Ooh. Up to left. Down to right. And up to the left. Down to right. Face forward. Tilt left ear to left shoulder. Or right ear to right shoulder. Left to left. Right to right. Left to left. Right to right. Left to left. Right to right. And the last one, left to left. Right to right. Good stuff. Shrug both your shoulders up. Slowly lower them. Up. Slowly lower. Up. Slowly lower. Quick story time.
Yeah.
I used to do this one with the patient actually face down on the table. but I got a big window over here, right, that people can usually see in through to kind of like so they can see what I'm doing. And I had one patient who was waiting for me, watched me treating the patient on the table, doing the trap shit. And when they came in, they asked me like if I was literally choking my patient out on the table, which I obviously had to clarify. No, I was not. But yeah, so optics, perception is reality.
That's so funny.
Yeah,
What does that do?
It just honestly, it just feels good. Okay, like we've already done all the therapeutic stuff, but shaking the traps out further, it helps loosen up the fascia a little bit as well as the muscle.
Right.
But the same deal everything else did.
Amazing.
Awesome. Steph, how did you find all of that?
It was really good. There were a lot of things that I'd never had done before. All the adjustments felt great. The part where you use the tools, that's when I felt a little bit of more pain with that. But I'm excited to see how I feel tomorrow.
Yeah, okay, no, that's just it. So one thing that I do give everybody the heads up on when they come in here is that the most likely side effect of seeing a chiropractor, also known as me, is the same most likely side effect of seeing a physiotherapist or a massage therapist, osteopath, whatever. You might be sore afterwards. Okay, we're going to go in there, we're going to work some pretty hard, some pretty stuck tissues, and sometimes the body doesn't like that. So some soreness to be expected. Don't be too concerned about it unless it lasts more than 72 hours. Okay, in which case, call me. Please call me. We'll talk. Yeah, no, you responded really well, in my opinion. Most people are pretty nervous the first time they're ever getting adjusted. It's kind of unnatural, right? But like you relaxed very, very well, so I'm impressed with you.
Thank you.
Yeah, do you have any other questions or comments, concerns, anything you're left wondering about? Or that's not how you need to ask stuff, but I want to give you that opportunity should you want it.
Nothing comes to mind.
Okay, well,
You
if
did
it
a great
does,
job.
feel free to email me, call me, whatever it is. Thank you for coming in today. Very
Thank
much
you.
appreciated.
Thank you so much.
Take care.
Don't forget to like, comment, and subscribe.
Thank you, Steph.